Did you know that the number one killer of women over the age of 50 is heart disease? And you know what the first symptom of heart disease is? A heart attack. That's not good. We need to do better than that. Today, I'm going to discuss with you how the standard lipid panel is not enough and what to get instead. Now, the standard lipid panel checks total cholesterol, LDL cholesterol, which is calculated, not actually measured, HDL cholesterol, and triglycerides. Incidentally, triglycerides are directly related to sugar and starch in your diet and not fat. Here's the thing. Truly, the gold standard to know if you're at risk of a heart attack is an angiogram, which is risky. They put a catheter into your femoral artery, thread it up into your cardiac vessels, shoot in some dye, and measure to see if there's any narrowing of the vessel. Everything else we do is an approximation. And the one thing we know for sure is cholesterol is lousy. Cholesterol misses 50% of heart attacks. Being that heart disease is the number one killer of women over 50, cholesterol misses 50% of heart attacks. What can we do instead? Let's dive in. An NMR test is very important, and it gives you particle number and something called ApoB. These are estimates and indicators of how efficiently your body carries cholesterol. The more efficiently it carries cholesterol, the lower your particle number and the lower your risk of heart disease. The less efficient it carries cholesterol, the higher your risk. But there's more. And there's a study done from the Cleveland Heart Lab looking at cardiovascular inflammation markers. And that's what I want to talk to you about next. Because inflammation is the problem. It's not cholesterol, it's blood vessel inflammation. You see, cholesterol goes to the inflammation and the blood vessel wall damage, kind of like a scab trying to clean things up, kind of like the fire department that goes to the burning building. Inflammation is the burning building. The fire department is cholesterol. Every time you see a burned down building, the fire department's been there. Does that mean that the fire department is responsible for the burned down building? No, it was trying to help. That's also what cholesterol is doing. It's trying to help. But because of the inefficient carrying and the inflammation and the immune system reaction inside the blood vessel wall, that's what happens. And that's what starts to form this complex called foam cells. Foam cells are a combination of inflammation and cholesterol, and that forms a thickening under the blood vessel wall that starts to slowly narrow the lumen, the opening of the cardiac vessels. It happens all through your body, but heart attack is going to be the life-ending situation here, or stroke. Okay, so if you've ever heard of a coronary calcium scan, that's not going to pick up this soft plaque. It's not going to pick up the immune complex. A coronary calcium scan is calcified cholesterol. That's been there a long time. It doesn't necessarily mean that you also have narrowing of the vessels on top of it. So once these blood vessels narrow, then you get kind of like an internal zit inside your blood vessels. If the zit ruptures, that leads to a blood clot, and now all of a sudden you have a heart attack. So there's an organized progression from completely normal to a clotted vessel, and there are markers that can tell you how far on this continuum you are. So the level 1 marker is early risk for disease, and that is oxidized LDL. Ideally, we want this less than 60. Level 2 markers are highly sensitive C-reactive protein, which is a non-specific marker of inflammation. Normal range is less than 3, but optimum for cardiovascular risk is less than 1. Another level 2 marker is ADMA, asymmetric dimethylarginine. This is a marker of how well your body produces nitric oxide, which is necessary to keep your blood vessels dilated, which improve blood flow. So it has to do with blood pressure and heart disease risk. ADMA should be less than 100 to be optimum. And then level 3 risk factors are concerning. That means you have presence of some of those foam cells and inflammation inside the blood vessel wall. The 2 markers we look at for that are myeloperoxidase and LPPLA2. Big, lots of alphabet soup letters there. But LPPLA2 should be less than 123, and myeloperoxidase should be less than 470. So looking at particle number plus these markers for cardiovascular inflammation gives us so much more information than just a lipid panel. These things are reversible. We can reduce inflammation, and reducing inflammation in your body will reduce inflammation in your cardiovascular system. It is important to know these things because we don't want to optimize your hormones and be at a good weight and exercise and find out later that you had super high risk of cardiovascular inflammation and that you had a heart attack. Heart disease is preventable, but in order to know your risk, we need data. And cardiovascular inflammation plus the NMR profile is excellent data that gives us reassurance or a direction to go in order to improve it. I'm Dr. Yvonne Karney. I'm the Hormone Locksmith. If you have found this information helpful, please share it with someone who needs to hear it. Write these tests down, take them to your doctor, ask to be screened. If your doctor won't screen you, get another doctor. Or there are places where you can go without even a doctor's order in order to get these tests done. May not be covered by your insurance. That's important to know. However, it's your life, it's your health. So take control of your health. I know most of you listening to this already do. That's why you're listening to this. I just want to give you the information to help you make better decisions about your health.